Yep. Yeah.
Hello, good evening, good morning, good afternoon, wherever you are. My name is Sue Campbell, and I am the program lead for the Masters in Health Service Management online. I also run on-campus version of this program at Glasgow University as well. So thank you very much for joining me. I've just got some slides I'll run through. And if you have any questions, you're very welcome to ask them. So this is just a quick 15-20-minute session. We're going to look at the University of Glasgow and the School of Medicine, Dentistry and Nursing. We're going to think about the benefits of the online health service management programme. I'll give you some explanation about the curriculum and the content. We'll also have some discussion on the key features of the online learning environment. You are on mute, so don't worry if there's noise going on in the background. And you're very welcome to ask some questions, and I'll try my best to answer them. And there will be a recording available afterwards. If you still have some questions, you can obviously also get back in touch. So just a little bit about the University of Glasgow. So as you probably know, it's a very old university, established in 1451. From our REF, which is sort of all universities submit a REF, we have 81% of our research is judged to be internationally excellent. We're also ranked first in the Russell Group for teaching, so among the Russell Group universities. We have had 7 Nobel laureates connected to the university, and we're also ranked in the top 100 of the world's universities from the QS World University Ranking. And just an example of some of the milestones, if you like, or the timeline for the university. We have Lord Kelvin, who developed something that we now call the temperature scale, which is now called the Kelvin scale. We're very proud to have Adam Smith as one of our alumni. We also, in medicine, we have Joseph Lister, who introduced antiseptics in surgery, and various other notable individuals who have been connected with the University of Glasgow. So we have 43,000 students from more than 140 countries at the university, and we are ranked in the UK's top 20 for graduate employability. We have more than 300 student clubs and societies, and we also offer study abroad opportunities in 200 destinations, which is mostly focused on our undergraduate students. But just a little bit about the School of Medicine, Dentistry and Nursing. So this is part of the College of Medical, Veterinary and Life Sciences. So there are a number of schools that make up this college. And the purpose of the college overall is to tackle major biomedical and life sciences challenges. We have, in the School of Medicine, Dentistry and Nursing, we have been awarded the Athena Swan Silver, and that's for our work on equality and diversity at the university. And we have connections to the Scottish and UK governments, to our National Health Service, our local authorities that provide quite a bit of our social care, and the voluntary and private sectors. So why would you undertake a health service management in the University of Glasgow? Well, I think one of the things that makes us different is that we do deliver this in conjunction with the Adam Smith Business School. So we have what's called professional pathways, and these are, there are some courses that fit with our professional pathways model, but we have 30 credits of the overall master's programme is delivered by the experts in the business school. We also explore management and leadership skills required for contemporary health service organisations. So we're very forward thinking. We're thinking about some of the challenges in health services and health service management. And we also ensure with your master's level study that you're encouraged to take a very critical approach to your learning, to perhaps think about the way things have been done in your own country, in your own practice, and thinking about new ways of doing things, or sharing some of the good practice you have from your own experience. So even with all the master's programmes at the University of Glasgow and our online programmes, all the content is accessible online. So it's 24/7, 7 days a week. It doesn't matter if you're in a different time zone. Our Masters in Health Service Management is made up of 60 credits, which are core. So that means 60 credits are compulsory. These are modules that you must undertake. And there's another 60 credits, which is made up of 3 20-credit modules, and they're optional ones. So you choose which 20-credit modules you would like to study. And I'll show you on later slides the kind of options that you might have. The core and the optional modules come together and make 120 credits. And then in order to complete your master's, you have another 60 credits, which are made up of your dissertation or your independent research project. And that altogether comes to 180 credits. So some of our optional courses. So each of these courses is 20 credits. We have things like leading improvement in care provision. We have transforming care services. If you're interested in teaching, or that maybe is part of your role, you might think about doing an option module on teaching in health professions. We also have modules looking at globalization and public health, so thinking very much outside of hospitals and individual health institutions, but thinking of the wider factors that might influence health outcomes. Also, another optional course is health promotion principles and practice. So thinking about preventive aspects of healthcare. So again, perhaps thinking a little bit more outside of hospitals and institutions and how we can prevent illness and improve health outcomes. So in terms of overall themes, our programme themes for the health service management are to provide a thorough knowledge and understanding of evidence-based practice. So we want you to be able to read and understand and critique the literature so that if you were developing a new intervention, there is some evidence behind what is likely to be successful. So we want you to be able to read the literature and identify good evidence that will help inform practice. We're looking to develop in our students a critical appreciation of relevant theoretical, methodological, and technical literature. So again, taking that critical approach to your learning. We're also looking at you to apply explicit management responsibilities and practices, and that you will demonstrate when you do your dissertation towards the end of your programme. In terms of career prospects for students that undertake health service management, well, we have health service management and social care management at all levels. Some students go on and work in large hospital organisations, some work in the farm's private healthcare sector. Quite a few students come from a pharmaceutical background and work in the pharmaceutical industry. There are students that work in charity organisations or some of the policy think tanks that develop policies and guidance documents for health service management. In terms of how the teaching takes place, and the assessment, so you might find on a particular, each module will have some assessment components, possibly 2 assessments per 20 credit module. This might be an essay, it might be a group work, it might be made up of your own presentation or designing a poster. Some of the teaching that takes place is we have tutorials, we have online discussion forums, we have journal clubs, we encourage students to get involved in peer reviewing, each other's work, and also peer reviewing literature and discussing it. And we also encourage reflective practice. So thinking about what you're learning, how it might influence your current practice, how you might use your practice, how you might use what you're learning in your future practice. Would you do things differently? In terms of the online environment, we also link your assignments to what we call our graduate attributes. So the university has a table, if you like, of graduate attributes. So what we're thinking about here is also those soft skills, you know, improving communication, taking on responsibility and leadership roles. So these are things that you can work towards alongside your master's program. And these are something that, you know, quite often employers will value, that the way you can sort of demonstrate those kind of soft skills. We like to use real-time discussion forums, so that, you know, students can engage with each other. And there's a, you know, when we've got an international community of students, there's a lot that can be learned from each other. How you might do something in one country might be relevant for how something could be done in another country. We have wikis and blogs and RSS feeds as well. There are some content of the module, which is interactive video and audio recordings. We encourage you to read journal articles and electronic books, and with access to the university library, you have access to a huge number of electronic documents and ebooks, available free of charge with your, you know, as you're enrolled on a student, no matter where you're based. And a lot of our books are digitalized now, so you can download them as an ebook. You wouldn't be expected to buy any textbooks or have any additional costs like that. A lot of the content is downloadable and therefore is available offline. So you might download it at home. You might then read it on the bus to work, in a sort of more user-friendly format for when you're traveling. It's accessible across devices. So whether you're using a mobile phone or a laptop or a desktop, you're able to access the content. And we also have some recorded lectures. So as I say, I'm Sue, I'm the program lead. I work with Barry Moen. Barry is the program administrator. So either of us can answer any questions that you have. But if you have any questions now, I'm very happy to try and take them. So if you want to put any questions in the chat, or I can go back to any of the slides if there's any that you weren't sure about. Very welcome. No, Anna, you're on mute, I think.
Sorry. I think a lot of question that some students ask is how they can network with other students, whether they have opportunities like seminars, conferences, and so on and so forth, because they also want to expand their professional network.
Yeah, absolutely. Online students are, so quite a lot of our, so even through our School of Health and Wellbeing, we run quite a lot of webinars, and students can join online. They don't have to be there in person. So there's, and these are run by kind of specialists, or people with, expertise in a particular field. We also have, for sort of student contact, then we have discussion forums, and you can interact with students either through the Teams page of the modules, or we use a platform called Moodle, through the discussion forums on Moodle, and students find that really helpful. And I think students do get a lot out of learning from each other, not just learning from the course content, if you like. So yeah, quite a lot of options.
And in terms of managing their time, yeah. So in terms of managing the time, how can students, how does a normal week look for a student, an ODE
Mhm.
student, somebody who's doing uh, the health services management program?
Yeah, so I would say you need to be looking at, 10 hours a week for your studies. I mean, it is one of these things, the more you put in, the more you get out. Um, Now I appreciate a lot of our online students are working full time. And sometimes there's a family and other caring responsibilities. So it is something to think carefully about. But I'd like to see people having, 10 hours, 10 hours a week to devote to their studies. With the online program, you can do it over a number of years. It doesn't have to be done in 2 years or even 3 years, which means that if something got in the way, like maybe you had an extended holiday, or maybe you had a baby, or maybe you had a very busy time at work, then you could pause your studies for that semester and then pick it up when you feel ready to come back, as long as you were in the time frame. So there is a little bit of flexibility there. Um, the other thing is most of the modules, uh, you, apart from the sort of assessment deadlines, there's quite a bit of flexibility there. So, for example, you might have 2 or 3 weeks at work, which are very, very busy, but then you've got a week's holiday and you're going to try to catch up with your studies. And that works fine for online, as long as you can sort of plan around the assessment deadlines.
What do you say are the key takeaways from the program? Is it, do you encourage more depth of understanding, or is it more of application of skills? So what would you say are the key outcomes that you aim for?
I think it's to really develop as a critical thinker, um, and to be an evidence-based manager. We talk a lot about being an evidence-based practitioner, but also being an evidence-based manager. And I think, quite often in health services, people kind of fall into management. They, they've been practicing as a clinician for a number of years, they're a practitioner, but they don't have an awful lot of management training. And actually, a lot of the challenges we see in health services now relate to, having, or require very good managers. So I think, having that master's in health service management really does set you apart. And it gives you that opportunity to explore different ways of doing things. I think another thing about, certainly in the UK, health service managers, a lot of it is kind of learning on the job. So you tend to learn what your predecessors have done. Whereas if you sort of step outside and look at the evidence, then I think it can be quite useful to then have studied at the masters and taken the time to think about, well, why do we do it that way? Maybe there is actually a better way of doing it, and sort of reflecting on that. Yeah. Hi, Anna.
How are you?
I'm good. How are you?
I'm good, thank you. I just wanted to get clarity. So, if I wanted to visit Scotland and also the University of Glasgow, would I be able to meet the faculty team and perhaps you as well?
As an online student?
Yes.
Yeah. So we are online like this. We do Zoom calls. We meet with students on an online basis. Obviously, if you were had a visit to Glasgow for some reason, we would be more than happy to meet you in person as well if you happen to be in the area. But yeah, we will do live lectures and things. You're not in this kind of black hole or a nameless environment. Um, we are real people that are kind of teaching, and we do also make recordings as well, lecture recordings. So you'll see real people. If that kind of answers your question.
Yes, it does. I'm just asking because my husband studies at the University of Birmingham. So every year, September, they've got like a contact session, even though he's also a long distance learner. So I just thought, like, yeah, it would be a great idea to use that opportunity to come down to Glasgow to also just have contact with you guys. Yeah,
Yeah,
because
no,
I
that
always go along with these trips.
okay. Yeah, no, that was so at the start of the academic year in September, we do induction for our on-campus students. And there isn't any particular reason, I don't think, why you could join in with the induction. I mean, a lot of the modules are the same. So yeah, no, that sounds perfectly reasonable.
Thank you.
You're welcome. Any other questions? Okay, no problem.
Like I've put some generic online distance learning links in the chat, and as you mentioned, your contacts are there as well on the slide. So in case anybody wants to contact you as well.
Yeah, no, please do. If you have a question or you think about a question afterwards, please do just get in touch and we'll answer it.
Perfect. All right. Thank you so much, Sue, for your time, and thank
No
you for
problem.
all the participants as well.
Yeah, thanks
Meru?
very much for joining
Sue,
us. Yeah.
just another question before we drop off. With regards to the
Mhm.
dissertation, is it just a research program that we're doing at the end, or is it also like a capstone project?
So you'll do a module on kind of research approaches as part of your 120 top credits. For your actual dissertation, you can choose. So you could do like a literature review, or you could do an original piece of research, or you could look at developing some sort of policy. So there's quite a number of options there, or you could think about doing some sort of quality improvement project. So yeah, there's a few options.
Okay, thank you.
All right, nice to meet you. Thanks very much.
Nice meeting you too. Thank you.
Take care.
All right.
Bye bye.
All right. Thank you so much, Sue. Thank you. Thank you very much.
Take care. Bye bye.
See you then. Bye bye.